So I am Dr. Ajwa, and I am here with my good friend and colleague, Dr. Zebib Abraham, and we're here to talk about concentration. It's a topic that a lot of us think about often, and it comes up in our daily lives because of the things that we have to do. There are always times when we feel like we can concentrate better, but sometimes we're thinking, is something really wrong with my concentration? There's a lot of talk about ADHD. So I've been joined here by my colleague, Dr. Abraham, who is a psychiatrist, also a writer, and knows a lot about concentration in the professional sense of treating people, but also with her own experience in having to concentrate when you're doing writing, which is a task that does require a lot of focus. So thank you for joining me today, Dr. Abraham.
Yes, excited about talking about attention. It's something I think about a lot.
So can you just tell us a little bit about yourself, where you kind of grew up and how you came into psychiatry and what you do now as a clinician?
Yeah, so trained mainly in New York, so for medical school and residency where we met, and you are a chief resident. So yeah, and then yeah, I'm trained in New York and licensed in New York, so I see New York patients in outpatient psychiatry. And simultaneously, while I was completing my training, I decided to pursue my sort of lifelong love of writing. And I did take a year off after residency to do an MFA in creative writing, and did that and have just been pursuing my writing alongside my psychiatry ever since.
And your writing is phenomenal. Like I am
Oh,
amazed by your talent, just how
uh,
these stories come out of your mind, and they're very harrowing, they're very moving, deeply touching. You really have a gift.
oh, thank you so much.
So when it comes to concentration, like what would you call concentration and focus? And what is normal concentration? And then what would you say is abnormal concentration?
Yeah, so I guess typically, if we're broadly thinking about what concentration or intention encompasses, um, being able to compartmentalize in any given moment, being able to sort of separate your thoughts, being able to think about tasks one at a time and doing tasks, one at a time, being able to have sort of clarity in the ideas you have in your mind in one moment. And attention involves lots of different aspects. We can't get into all of those aspects, but sustaining your attention, having selectivity with your attention, planning, organizing your memory, like your working memory and your long-term memory, being able to problem solve and like thinking multiple steps ahead, prioritizing, time management, being able to recognize patterns, and also being able to task switch. So I think attention encompasses all of that. So difficulty with attention would be trouble with all of that. So just like overwhelm, having multiple thoughts at once, not being able to sort of focus on one task at once, not having clarity, then feeling maybe impulsive, feeling disorganized, losing track of time. Um, yeah, just feeling muddled.
And I think a lot of us do have times when we are doing something and we get a little bit distracted. And so that's normal. Like you can't focus on something for 5 hours straight. Real, I mean, you need to take a break or something. So, and I think it also depends on the type of task that you're doing. So some tasks I like literally feel like I almost have a headache after doing. Maybe
Yes,
if I'm writing something or if I was doing math back in the day, whereas I can watch a movie for 2 hours and it doesn't maybe require as much real thinking energy juices. I don't know how to really describe that
totally.
scientifically, but what is a normal good amount of time that you should be able to focus on something? Let's say it's a task that does really require a lot of concentration, like writing or um, sending emails or a task at work like, yeah, what is normal? And then when will you say, no, this is my concentration is a little bit abnormal.
Yeah. So, nowadays, and I think it would be hard to define anything as like normal or abnormal. I guess what is the spectrum of attention, and when does that tip over into like feeling like it's hard to function? I would say that I can't give you an exact number because that's something that's shifting all the time in within our lifetime, within the last, like, even few years. And they've literally done studies where they've, assessed how long does a office worker or student maintain their attention on a particular, thing that they're reading, um, or a particular task at work. And people are, and this is typical, switching, um, if not every few minutes, multiple times within a minute. And I
Mhm.
think that's something people can just observe in themselves, whether or not you're diagnosed with ADHD or have ADHD or not. Um, People cannot sustain their attention across the board probably for a few minutes at a time. I think people struggle with that nowadays. And also the type of task you're working on, the environment, all of that influences it. So I would love if I was writing that I could sustain my attention for, you know, anywhere between 10 to 30-minute bursts. And to me, that seems quite like reasonable. And a lot of advice around time blocking or sort of the Pomodoro method is around that.
Mhm.
Uh, if we try, yeah, it's we're going to struggle sometimes to even
Yeah.
achieve that.
Yeah, I think that you're right. It depends on what you're actually doing. And I feel like when I start to say, is my concentration normal? I do look at my progression. Like in the past, was I able to concentrate on something like this for X amount of time? Am I not able to do that? So what is abnormal for myself and
Yes.
the people that are around me doing similar tasks? And right now, a lot of people are thinking about their attention because, to be honest, our brains are being rewired, like you mentioned. A lot of us are talking about that's happening because of social media, how we're getting input all the time now. It's coming very fast, whether it's the news, whether it's the things that we just have to deal with every day. It's just very fast. So I find now that I even wonder, wow, I could think about something, focus on something for 5, 10 minutes. Now, if I don't have the message in 20, 30 seconds, I'm already bored, or why can't I focus or concentrate?
Yes.
And so when a lot of people are now starting to think, do I have ADHD? And that is something that I think a lot of people, rightly so, should be wondering about. The diagnoses have gone up because we have different criteria that allows us to make diagnoses in adults better than we were able to do in the past. So I guess when would you start to say people should really be concerned about their ability to focus and to concentrate? And when would you um, seek a diagnosis, and what does that diagnosis look like? Like, what are you asking a clinician as a clinician?
Yeah, I this is such an important question, and I think it can become kind of fraught. I think ADHD is both overdiagnosed and underdiagnosed, so it's a complicated issue, and particularly since COVID-19, at least in my practice, and I think overall, like people have probably seen this in mainstream news. Uh, ADHD diagnoses have gone up. Um, Part of the stimulant shortage issue that's been like plaguing the US has been so much demand for stimulants. That's part of the issue. So, what does actual ADHD look like? I think there there's a bit of gray area nowadays, given just how fractured uh, the typical person's attention is. But if you want to think about it broadly, attention being a problem to the point that you struggle to function in your work life, your social life, just your daily functioning. So if your inattention issues are leading to just difficulty like getting through school, doing your job on like a fundamental level, then you would want to potentially consider ADHD. And I think that it's interesting. Diagnoses um, are really varied on how you get a diagnosis, particularly in the United States. So, as a psychiatrist, there's not necessarily a streamlined way in which we would diagnose. We would ask a lot of questions, of course, DSM criteria, but just broadly, lots of details about someone's attention. And we might go through some scales, just assessing symptoms over the last 6 months. Like that's particularly something I do, and also developmental history. So these are all things that go into the picture of a diagnosis.
And what are some of the symptoms that you're specifically asking people about?
Yes. So it'll be in various domains about distractibility, impulsivity, um, sort of impatience, difficulty in sensory sort of inputs, socializing. So, be asking, do you have trouble focusing on what someone's saying to you, even if they're speaking to you directly?
Hmm.
Do you finish their sentences before they do impulsively? Do you have trouble completing the final details of a project even when the challenging parts are done? Or
Mm.
do you have trouble sustaining your attention when the task is boring or when it's difficult? Do
Mhm.
you find that you're like disturbed or distracted by noises? So these kinds of things, like trouble waiting in line. Um, that you're often late, or miss appointments. All these kinds of things are important questions.
Yeah. And like you said, I think it's a lot of you're taking in everyone's experiences, their functionality before you're able to make a diagnosis because a lot of those things might be true for people, but it's not
Yeah.
incapacitating us so much that we're not able to keep up with our work or our regular day-to-day job. So I think that's the important thing to remember. But definitely I have felt myself finding it harder to concentrate on things. And I don't know if that's just adulting, we have more
Yeah.
things to do in life,
Oh,
or if my
absolutely.
brain is being rewired by how our society is set up and with our phones, with social media, with
Oh,
all the inputs and just things that we're asked to attend to.
I agree
Yeah.
completely, and I wanted to add, because you're reminding me that, um, we have so much on us on a daily basis, bombarding us, so many demands, so much burnout and stress that also really impacts attention. So, as clinicians, we'd really want to know if someone's feeling depressed or anxious or burnt out, because that also affects our attention.
Mhm. And so a lot of people are maybe thinking medications can help me. You mentioned that there's a stimulant shortage. That's what we typically use to treat adults with ADHD. But some people may not want to take stimulants. Some people may not be able to get them. Their insurance may not cover it, or you want to try something else. And so I was wondering, like, what are some of the other things that you recommend for your patients? And we'll first talk about patients. And I think then maybe even some things that you might have found personally in your more creative life that have been helpful to help you focus.
Yeah, so, I will say that, there were a lot of stimulant prescriptions happening since COVID yeah, in an ongoing manner. So, stimulants will help anyone, broadly. If you have certain diagnoses, they could definitely be bad for you, worsening anxiety or psychosis, etc. But generally, people who don't have like baseline other conditions will get a boost from stimulants, hence why people abuse it in college, things like that. But it doesn't mean stimulants are not highly helpful and useful, those with ADHD. But we also want to think about not only like simultaneously making other changes in life and how you function, because the stimulants will not just like sort of magically change the whole way you approach work. You have to direct their benefit somewhere.
Mhm.
So first with medications, there are stimulants, but there are also non-stimulant medications such as Wellbutrin and Strattera that I think we don't get enough attention. So I myself have a diagnosis of ADHD and do use a non-stimulant. So it's a different sort of effect, but over time, it can have a more gradual benefit with less side effects. So that's something I think a lot of people could benefit from without needing to be on a controlled substance. And in terms of what I recommend to my patients, it's the same thing I try to do for myself. So there's so many different ways in which you could shift what you're doing to help yourself out. And it could be in ways actually that people don't realize. One big thing is trying to do too much. I think that is a big issue for people that they're driven by certain ideas of what they should be doing, by anxiety. They're trying to do so much at once. Um, they're having trouble sort of separating out tasks. It's getting muddled in their mind. So just do less. I think if that could be a take home for people, do less. Um, and that will also involve accepting your limitations. First off, we do want to help with attention, but like you said earlier, you cannot sustain your attention for hours. You cannot do everything. And accepting that is important. So, working on doing one task at a time, on being very specific on what the task is. So, all of this in creativity is like important. Like, just work on one project, work on one aspect of it. If you're going through your work and becoming distracted, just being mindful, like, okay, I notice I'm writing and I'm like checking my phone every 5 minutes. So if you're in your body, if you're mindful, you'll notice you're doing that and sort of pay attention, be curious. What's driving me to check this? What am I feeling in the moment right before I go to check my phone? Is it some negative emotion about the task that it's really hard or that I feel I won't progress, that I'm not going to get this published, that I can't figure this out? And sort of actually trying to address that stress or negative feeling or boredom or whatever it is with self compassion. Um, and also rewards, sort of giving yourself prompts to get through it,
Yeah.
whether that's like, okay, if I work for 20 minutes, 5 minutes of a break, and I can watch my YouTube video then. Oh, I feel the urge to be distracted. Why don't I just delay that urge 5 minutes? Then I'll let myself be distracted. These little tricks to kind of keep you going. And yeah, I can name plenty of other things.
Yeah, no, I'll ask about the other things, but I do like that trick of giving yourself a little bit of a reward to say, all right, this is boring, but when I'm done with this, then I can do something that I enjoy a lot
Yes.
more. And that now that you have named it, I do find myself sometimes doing it like, okay, I have to finish writing this patient note. But when I finish this patient note, then I'm going to go get my tea, or then I can have my lunch break, and I'm not going to write my note during my lunch break. I'm going to have a complete 20, 30 minutes off where I can just enjoy that solitude. So I really do like that. Little rewards throughout the day. It doesn't have to be something very big. Um,
Yeah.
and then you also mentioned, what was it? You mentioned limiting what you do. Sometimes I think people feel like there are things I can't. Like if you have kids, you're going
Mhm.
to, especially young kids, you're going to have to make their food, get them ready for school, pick
Yes.
them up, and then you go to work and you also have those tasks. So then what, how can people that have very real responsibilities that you just cannot get rid of? They're there, they're always going to be there for the next 10, 20, 30 years. Um,
Yes.
how do you limit yourself, or how do you set, I guess everyone talks about the words boundaries, but how do you um try to streamline what you're doing?
Yes. Okay. I think that there's two aspects to that, like acceptance and then the boundaries and prioritizing aspect. So, as a side note, one great book called 4,000 Weeks by Oliver Berkman does touch on a lot of these points about accepting our limitations, and he does touch on the point of work demands and children. So, um, those are things we have to do. We have to take care of our kids and do our jobs so that we can have a roof over our heads. So there's some level of acceptance of that, that yes, you know, I I have a limited amount of time and I'm choosing to do these things I'm responsible for during a bunch of that time. I'm not helpless. I'm choosing to do this. This is how I'm spending some of my time. And then leftover time I have, that's what's available for me for whatever task I'm trying to get done. And but also, people bring this up, like, how do I have a writing life when I have a job and kids? And um, there are some ways in which you can try to make time for yourself that maybe doesn't seem possible, right? Maybe it's really just getting supports where you can. Uh, who can your partner, right, watch your kids for that hour, right, that you want to work? Can you cut back on work in any way? Can you get up earlier, right? Can you do these things where you take moments for yourself to prioritize, right? Make it happen as much
Mhm.
as you can.
Yeah. And when it comes to writing in particular for you, I was wondering if you have any tips with regards to that, because I think that is one of the hardest tasks for people to do. So, what are some things that you have discovered in your writing journey?
Yes, so much. First off, writing is really challenging, as you probably know from academic writing or clinical notes and whatnot. It's a solitary task, and it's a cognitively demanding task. It's generally not just going to be something that's like watching a movie, right? It involves constant problem solving, constant sort of accessing of memory, uh, constant sort of reorganizing of things, and that is challenging because it's like demanding a lot from you, and it's difficult. So recognizing that, and having reasonable expectations of yourself. So also understanding the task you're doing. Are you outlining? Are you editing? Are you writing something new from scratch? And sort of understanding, like, how do each of these tasks, like, are they demanding for me? Some people like one task or another. So understanding that and not giving yourself, hours of I'm a block, I'm going to do all this editing when it's super difficult for you, like really scaling back. So I think understanding exactly what your goals are and tasks each session, um, having a reasonable set of time that you're working and then breaks. Like, it doesn't have to be Pomodoro method, but taking breaks, like actually taking your breaks and
Mhm.
stopping. Um, and yeah, just sort of noticing what negative feelings might be coming up about your writing. Like, what is your motivation for doing this? Can there be an internal motivation that helps push you? Uh, are you perfectionistic? Sort of trying to work on that. Noticing when you're getting distracted. And also it's building up your ability to like sustain your attention. Like, yeah, maybe it's 2 minutes and the next time it's 5 minutes and next time it's 10 minutes.
That makes sense. I think for the method that you're describing,
Pomodoro, I keep mentioning the Pomodoro method. I
yes.
actually couldn't accurately tell. I think it's like 25 minutes on, 5 minutes off, something like that, in chunks of like four at a time.
Yes, I've heard of the theory, but the actual name I haven't mentioned. I think that is definitely something to keep in mind, and something I've heard repeatedly. And I think in college, I had a professor that alluded to that. He said, study for about 50 minutes, take a 10-minute break. But that has resonated with me. And that's what I tried to do when I was even writing my graduate thesis for weeks and weeks, locked away in a room, 50
Yeah,
minutes of work, 10 minutes of a break.
amazing.
The breaks are very, very key.
Mhm.
Um, and then I don't know if there are any other tips or things that you want to say in general with regards to focus, concentration, how we deal with all the inputs that are coming into our lives. Any last thoughts?
Yeah. I also, like, I did talk a lot about negative emotion, but really a lot of managing our attention is emotional regulation. So we really don't want to do these hard tasks because we just sort of see them as threatening in a way, almost like getting at the fear centers of our brain. Hence why we procrastinate against all reason, even when we really don't want to,
Mhm.
and we feel paralyzed to do a task. So really being compassionate with yourself and also looking at the guilt. So many of my patients and like people, I experience guilt around how I should be doing things, getting distracted, and realizing that that is sort of distorted and unfair. And being not having wishful thinking, if you know, like, hey, I'm actually wasting a lot of time, just like assess yourself one day when you're trying to do your work and really be clear about, okay, did I actually like waste like half this time? Okay, let me like not try to work for that long next time.
Yeah.
um and yeah, also having a supportive environment, people you can work with, and just paying attention to your physical health as well, your stress levels, all of these things. Yeah, that's definitely, all of that's key.
Yeah. I think what you mentioned about having some fear around the tasks that you have to do is really key. And even though it might seem mundane, but having to write um, a page, a letter, whatever it is, you're just like, oh no, it's going to be really hard. I think it's going to take me 10 hours to do that. And that prevents you from even starting or doing something, or you're worried about actually doing it perfectly and doing it in one goal. And that's a go. And that's something that I've started to recognize in myself when I feel worked up with a task. But I also think that there's something that you can do, which is doing what you consider easier first in your long list of things to do. So,
Yes.
like, I do have to do this, but at least let me do the easier, less mentally intense thing. It'll make me feel good about checking something off my list because that still has to get done. Some people might say it's a bad tactic where you leave the most critical thing to the end and you're like, oh, I have that
Mhm.
little adrenaline rush, I get it done. Sometimes that works. With
Mhm.
me, I don't want to always have to rely on that tactic, but I think, like you said, recognizing that fear in the task, why you're nervous about doing it, and trying to figure out, okay, how can I try to do a little bit of this better here or there? Maybe I can plan the task, then actually do the task the next day, would be helpful.
Yes,
So,
absolutely. Yeah,
yeah.
all great points.
Well, thank you so much for joining me, Zabib. And I really have enjoyed talking with you about this topic from someone that is really an expert in treating patients that have issues with concentration, but also people that are like, as a writer, like you actually produce stuff. And I know that you have found a way to focus because of the work that you have produced. So thank you for joining me here on my YouTube channel. If you liked our conversation, please remember to like, share, comment, and subscribe. And we hope to see you another time. Bye.
Thank you.